Hi there, this is Nazul, and this lecture is on infection and fever. This is part one of the lecture where we'll be looking at what is an infection, what are some agents that would cause an infection in clients in the healthcare setting, what are some common microbes that can be found in your healthcare setting, and also looking at the properties of microbes and how they're causing a disease, and looking at the stages that are involved in a disease process. So when we look at infection, we want to ask ourselves, what is an infection? So an infection is caused by the invasion of pathogens, and pathogens are disease-causing microbes. So things like bacteria, viruses, fungus, they invade the body and they're going to multiply. Once they overwhelm the host, that is your clients, your patients, once they overwhelm the host defenses, they're able to mount what is called an infection. There's many microbes out there. So when we talk about pathogenic microbes, they could be bacteria, they could be viruses, fungi, protozoa, prions, etc. Most common in our healthcare setting is often bacteria and viruses. To a very lesser extent, you might see fungi or protozoas that's causing infections. Once these microbes have entered the body, the human body is going to mount two types of defenses. They're going to trigger a non-specific defense and or a specific mechanism. So if you recall from inflammation, there are three lines of defenses that often a human body has. The first line of defense is things like your skin, your mucous membranes, and they're non-specific, meaning that they're protecting you irregardless of the microbe that is entering the body and or any type of injury or anything that enters the body that is considered non-self. So your skin will protect you at all times. Your mucous membranes, enzymes that you might have would also be released to protect you. So it's irregardless if it's a bacteria, a virus, those line of defenses, the first line of defense is always present to protect you. Then you have your second line of defense, and this involves inflammation or the inflammatory response. It also involves the MPS, which is the macrophage phagocytic system. And again, this is also non-specific. So an inflammatory response would be mounted once there is an injury to the body and or anything that enters the body is considered non-self. So it could be a microbe, a bacteria, it could be something mechanical, it could be thermal, it could be chemical. The second line of defense will be triggered to protect you. And then you have your more specific defense mechanism, and that's where our third line of defense come into play. That's the third line. And this is more a specific response in that when something affects the body, the immune system is now going to be more selective in what is going to be activated. So some types of infections might trigger T cells to be released. They might trigger B cells to be activated, or certain types of antibodies. So for example, if you have an allergic response, you're going to have specifically IgE antibodies that are released to protect. So when microbes enter the body, they are always going to trigger both defenses. So they're going to be triggering your non-specific defenses, which is your first and second line, and also specific mechanisms such as your third line of defense. When we have an infection, or when your clients have an infection, they're often treated with anti-infective medications that is targeting to help to remove the microbe or suppress their activity and prevent them from multiplying. Because remember, once they invade, they would then have to multiply themselves in order to overwhelm your patient's immune response. Because once a microbe or once anything has entered the body that is considered non-self, there is always your body is going to put up a fight. So your immune response will take over and try to protect you at every cost. So your client's immune response will be triggered to try to get rid of the microbe. However, if the microbes have multiplied, to sufficient numbers, sometimes they're able to overwhelm your immune response. And in that case, that's where we intervene as healthcare professionals, and we're now going to treat the client with anti-infective medications. So there are many different categories of microorganisms that can cause infection in a client. So bacteria, viruses, fungi, protozoa, chlamydia, rickettsia, and mycoplasms, helminths, and prions. The most common usually, though, are the bacteria and viruses. You might be happening upon some infections that are caused by fungi or protozoa. When we refer to microorganisms or microbes, they're very small. They can only be detected with a microscope. And so when we want to understand and or treat a particular microbe that has caused a disease in a patient, what often we do is we have to develop those. So we send off the specimen in which that microbe might be growing. And so in a lab, they would smear that on what we call agar plate. And on the agar plate is where these microbes are going to start to colonize and grow. And so our microbiologists would then make an interpretation of that. And so the decision will be what type of anti-infective would be most effective at treating the particular type of microbe that the client currently has. So once it's developed, so often what you would see is, let's say, for example, you have a urinary tract infection. And so we know at the time that you have an infection because, they've tested the urine, it comes back positive for an infection. It says you have leukocytes, which are white blood cells growing. At that time, we may not know exactly what's growing. So the physician might give you an antibiotic that is often most commonly used to treat the urinary tract infection, for example. However, that urine is then sent to the lab. We're now going to do what we call a culture and sensitivity on that urine, where they're going to take a sample and smear it on an agar plate. They're going to develop that. And once that's done, that's where we're going to see what type of microbe exactly is causing that urinary tract infection. And if they recognize that the antibiotics that you were given to treat it is not sensitive enough to treat the microbe, the physician is going to call you back to change the antibiotic to something that is more effective, that will treat that infection that you currently have. So this is how we guide our treatment. Is often we do a culture and sensitivity where we understand exactly what type of microbe is causing that disease in the patient. So microorganisms would produce an infection based on two qualities: the degree of their pathogenicity and the virulence of that microbe. So you want to ask yourself, what does pathogenicity means? And pathogenicity means the ability of a microbe to cause a disease in a person that's considered healthy. So when we look at a microorganism, what is the organism's ability to cause that disease once a person is healthy? And there's many, many characteristics that a microorganism or a microbe might have that increases their degree of pathogenicity. And we'll talk about that in a minute. When we look at virulence, on the other hand, it's the ability of that microbe to now overcome or overpower that host defenses. So remember, once a microbe invade, like I mentioned before, once a microbe invade a human body, our immune response or our defenses are going to be activated to try to overcome that microbe. However, sometimes, and it could be a number of reasons why, the host defenses is not able to overpower or overcome the microbe. And so we would see the opposite, where that microbe is able to multiply in numbers and then overpower our defenses or the host defenses. So when we're looking at a microorganism's ability to develop or cause an infection, it really is based on these two things: the degree of their pathogenicity and the degree of their virulence. And pathogenicity is the ability to cause that disease, first off. Like I mentioned before, there's characteristics that microbes can have that would increase their pathogenicity, and their virulence, which is their ability to overcome or overpower the host defenses. So when we look at the degree of pathogenicity, as mentioned before, there are some specific characteristics that microorganisms can have that will increase the degree of their pathogenicity, or in other words, their ability to cause a disease in a healthy person. So let's look at some of those. One of the very first thing is their invasive ability. So their invasive qualities or invasive abilities. So their ability to enter that host. That's one of the big things. So the more a microbe, if it is invasive, the easier it is to enter the host and then to cause an infection. They also have toxic qualities. So microorganisms can release toxins, and there's two types of toxins that they can produce, endotoxins, exotoxins, that will damage the host cells or interfere with the functioning of the host cells. So they can make endotoxins, exotoxins, and some may also even make enzymes. So they might make some enzymes that can cause damage, some serious damage to your host cells or interfere with the host cell functioning. Their ability to adhere to the host tissues, so their adherence to tissue. And so when you go through the property of your microbes, some of them have what we call pili or fimbriae, and those things help them to stick and or attach to the host. And the better they can adhere to the host, it's easier for them to then attach to the host member receptor sites and then enter the host cells and cause damage. And then their ability to avoid the host's defenses. So remember, the host would always mount a defense. The ability of that microbe to recognize that the host is mounting a defense against them and to avoid. So the ability to avoid the host defenses. Some microbes, for example, bacteria, they can have a capsule. And in that capsule, they protect themselves so that they're not easily destroyed. So when we look at these different qualities, so the ability to invade the host, the ability to release toxic substances or enzymes such as endotoxin, exotoxin, the ability to adhere to the tissue and the receptor sites of the host and then enter the host cell, their ability to avoid the host defenses, would all increase the pathogenicity of that microbe and makes it even more powerful in mounting an infection. Bacteria are the most common microbes or microorganism that would cause an infection. And so when we look at bacteria, they're referred to as prokaryotic cells, meaning that they're very simple in their structure, but they tend to have a more of a complex cell wall. Most of them are unicellular, meaning that they do not have a nucleus and they don't really rely on their host for survival. So they do not require a living tissue in order to survive. They're capable of doing their independent replication. So they don't need a host in order to reproduce and multiply. Unlike their counterpart virus, which we'll talk about in a minute, bacteria can survive on their own, and they replicate by the process that we call binary fission. And so when we look at binary fission, and the next few slides we'll look at binary fission, that's where the cell will divide, and so they'll produce two daughter cells that will then be identical to that initial primary cell that we're looking at. So major groups of some bacteria, they're bacilli, spirals, cocci, and so that's not really important at this point, but it's just nice to know that bacteria can group themselves into bacilli or spirals or cocci. So when we look at the basic structure of our bacteria, like I mentioned before, there's a rigid cell wall around it. Some are gram-positive or gram-negative. And that really has to do with the staining once we try to stain and know what type of bacteria we're having. And based on whether they're gram-positive or gram-negative, they can also produce different types of toxins. They do have a cell membrane, and some might have an external capsule or a slime layer. And remember that external capsule, again, is one of those features that increases the pathogenicity because it's all built in to help to avoid the host defenses. They might have a flagella that will help them to move, so to get by and get through. So that's what the flagella is there for. They have a pili. So some would have pili or fimbriae, like we mentioned before, and the pili is there to help them to attach, whereas the flagella helps with movement. So they're able to move once they enter the host body. They have a cytoplasm, and then, like mentioned before, they do have or can produce toxins, so exotoxins and endotoxins and or enzymes. A way to remember it is your exotoxins are produced by your gram-positive. So exo, if you spin the X, it becomes a T for plus. So exotoxins are being produced by your gram-positive bacteria. Endotoxins with the N inside are produced by your gram-negative bacteria will produce the endotoxins. This is just showing you the different kind of bacteria morphology that's out there. So bacteria can exist as cocci, bacilli, or spirochetes. And once they're in cocci, they could be in clusters. Those are called your staphylococci bacteria, or they can exist in chains, streptococci, or in pairs, diplococci. Also, they exist as bacilli, which more looks cylindrical. They come in different sizes and pretty much different forms. And then you have your spirochetes or your spirals, often can be associated with STIs like syphilis, etc. So we've mentioned about gram-positive and gram-negative bacteria before, and this is kind of just giving you a quick overview of the different layers in a gram-positive bacteria cell wall versus a gram-negative. And so you could see, for example, the peptidoglycan layer, how thick it is, and how much of a protection that it's able to provide that bacteria. Again, going back to the pathogenicity quality of bacteria in avoiding the host defenses. So again, this is just an FYI and nice to know to show you the difference between the cell wall between a gram-positive versus a gram-negative bacteria. So when we revisit the bacterial toxin again, just a quick recap that there are endotoxins. And remember the N, again, we're talking about N for negative, are produced by gram-negative bacteria. And exotoxin, if we were to spin the X, it becomes like a plus sign. And those are produced by gram-positive bacteria. And usually they get sent through the body fluids. Now, these toxins do have unique characteristics, where the endotoxins are more heat stable and they are able to cause disruption in the cells. They also tend to activate the coagulation system of the host. Whereas exotoxins, they're more heat liable toxins and they are secreted, but their effects are a bit greater than that of the endotoxins. So this again is just to give you a general idea that these toxins can be harmful to the host defenses. It can paralyze the host defenses and cause damage to the host cells. In addition to endotoxins and exotoxins, bacteria can also produce enzymes, and some of these enzymes, what they do is, for example, you have the hemolytic streptococci bacteria. They produce hemolysin, and what hemolysin does, it destroys the red blood cells and causes hemolysis of red blood cells. So taking into effect whether it's endotoxins, exotoxins, and or harmful enzymes. These, again, are all different ways in which microbes or bacteria can increase their pathogenicity by overcoming the host defenses. So this is just going back to how bacteria replicate. And remember, we mentioned earlier that replication is by something called binary fission. And with binary fission, you have the cell is first going to divide. The bacterial cell divides, and it divides into two daughter cells. And these two daughter cells are identical to that parent cell. And so once these two daughter cells are formed, they're going to go on to replicate again to produce another two daughter cells that are identical to that parent cell. So that's how bacteria tend to multiply. So once a bacteria enter the host body, in order to increase the bacterial numbers for the host, that bacteria will duplicate itself by something called binary fission. The next common microbe that will cause infections in your clients are viruses. And viruses are really, like it says, they're small parasites. The reason why they're referred to as parasites is because they're completely dependent on the host for their multiplication and for their duplication. Viruses can contain, their genetic material can either be that of DNA or RNA, and as mentioned before, they're totally dependent on the host cell for energy and replication. So often what these guys are referred to as, we call them, they're obligate parasites. In other words, what does that mean? If the host cell is not available to the virus, they're unable to replicate, and so they will not be able to increase their numbers because, again, they're dependent on that host cell to have the energy that is needed for their replication to occur. So if you think about viruses compared to bacteria, remember, bacteria will undergo their binary fission irregardless of the host. It's not dependent on that host to do so. Viruses, on the other hand, in order to form new virions, they need that host cell to do so. This is kind of just giving you an example of how viruses work. And this is an example when it comes to HIV. And I know it seems very complex, but the only thing this picture is trying to capture is once we have a virus or the HIV virus, it has to penetrate that host cell first. And this is a little ahead of you, but often they're dependent on T cells or T lymphocytes for the host. Once they go in, as you could see here, that viral DNA component is now entering the host cell. And once it enters the host cell, it starts to integrate itself into the host genetic material. Once that occurs, it undergoes a chain of steps, and then new virions are formed. So really what this is just showing you is going back to that they are obligate parasites, viruses. They need their host cell in order to multiply or replicate, in order to increase their numbers to overcome that host defense. Another microbe or another microorganism that can be harmful to your clients are fungi. Fungal infections requiring major treatments within the healthcare system is not often seen. Like mentioned before, mostly you see bacterial and viral infections requiring treatment. Fungi can be considered actually beneficial. So if you think about things, even in our preparation in foods, it's used in yogurts, etc. Also, it can be used in antibiotic production, but sometimes they can become pathogenic. And like I mentioned again before, fungal infections are not often seen as major, requiring major healthcare interventions within your clients. And these are just showing you, these pictures are just showing you when fungus can cause diseases. So the first picture is just looking at what we call athlete's foot, and the second is oral thrush or oral candida, which can be seen in clients. So again, these are fungal diseases that you could see often, like I said, don't require major, or we don't see them very often requiring major healthcare interventions. The two major ones are your bacteria and your viruses. So in our human bodies, we have something called normal flora. A normal flora is really a group of microorganisms that tend to live either inside certain cavities in the body or even on the skin. And when they live there, they really are non-pathogenic. They do not cause the disease. As a matter of fact, they could be beneficial to their host. And one of the big benefits is really also to prevent other microorganisms from invading the host. So when we look at the normal flora, like I said before, they're non-pathogenic and they reside either within cavities of the host or they're going to on the skin of the host. That's where they reside. Now, they're only found in areas that are considered non-sterile. So areas such as the skin, the nasal cavity, in the mouth, in the GI tract. They're not found in areas that are considered sterile. So areas such as the lung, the bladder, the kidney, those areas are sterile and will never find these microorganisms living in there. Different areas or different cavities in the body will tend to host different varieties of microorganisms when we're looking at these normal flora. Now, under normal circumstances, like I said, they're non-pathogenic, but there's always an opportunity for these microorganisms to become pathogenic. So there are clear situations when these can become pathogenic, and if they do become pathogenic, they develop what we call opportunistic infections. But these are under special circumstances where your normal flora would then become pathogenic because those conditions are met. Other than that, our normal flora is actually beneficial to us as host, and there are different species that will be inhabiting different areas of the body. Non-sterile areas only. Sterile areas such as the lung, the bladder, and the kidney do not have a normal flora existing in them. So some of the roles of the normal flora, one as mentioned before, is they help to deter the invasion of other microbes. So an analogy to put this into perspective is even in your own home, having residents in your home, every person have maybe a room for themselves, right? So when you have guests, you're sharing that room. And so in sort of the same way, when we have our normal flora is going to occupy a particular cavity in the body, let's say in the GI tract, then they will prevent or deter other microbes that could likely be pathogenic from coming in and taking up room in that area. Now, obviously, if your normal flora gets disrupted or gets displaced, then that will create room for other microbes that could be pathogenic to now take up space in there. Another benefit to having a normal flora, it helps with digestion and also helps in the synthesis of vitamin K, and it helps to maintain the pH in the skin and the vagina. So in women, when again that normal flora gets upset, this is what we can develop things like yeast infections and all those other things, right? Because that's when our normal flora helps to maintain that pH to prevent the growth of other microbes in those areas. So these are just capturing some of the benefits or the role of having a normal flora in the human body. So as mentioned before, normal flora, once they inhabit certain areas of the body, they are non-pathogenic. So they do not cause the disease. However, as mentioned before, normal flora does have the ability to at some point become pathogenic, but it's only under certain circumstances. So one of the reason is if they are transferred, if the normal flora gets transferred to a different location in the body from where they would normally inhabit. So transfer to a different location. So let's give an example here. So normal flora resides in the GI tract because it's a non-sterile area. Let's say you're providing care for your client and somehow by accident you wipe in a different direction if the patient has a bowel movement, and you transfer those microbes into the genitourinary area. Remember, the bladder is a sterile area, so if those microorganisms get into the bladder, so you're transferring it from the GI tract into the bladder, that would cause the patient to develop a urinary tract infection. Another reason why the normal flora can cause a disease is if the balance of the species become altered. So the balance of our normal flora, balance of the normal species, so the balance of the species in the normal flora is altered or become altered. And so you're probably thinking, what would cause this alteration to occur? So when we give our patients antibiotics to treat a disease, those antibiotics may not be specific to just get rid of the microbes we're trying to treat. Sometimes what those antibiotics might do, they might actually destroy microbes or microorganisms that's part of the normal flora. And once the normal flora gets destroyed, if you remember from our previous slides, we said it prevents other microorganisms from inhabiting those areas. So by destroying them, it's like I'm removing occupants from my home that would leave room now for other microbes to grow, right? So the balance of the species become altered, for example, with the use of antibiotics. Okay. Another reason for when normal flora can become pathogenic is if the body defenses is impaired. In a case of the client becomes immunocompromised or immunodeficient. So with immunodeficiency, or if a patient becomes immunocompromised, then this would cause normal flora to become pathogenic. So think about clinical incidences of patient becoming immunocompromised. HIV patients that has developed AIDS will cause them immunosuppression. If your patient has cancer and they're on chemotherapy, that would also cause them to become immunocompromised. When this occurs and an infection develops because the client is immunocompromised, these are referred to as opportunistic infections. Okay, so these are opportunistic. So these are the big ones, I would say, where a normal flora would cause a disease, or where normal flora or species or microorganism in a normal flora becomes pathogenic. So just to recap, we're moving them from one location to the next. So their normal location to a location that is normally sterile. We kind of kill off, or we upset the balance of the species in the normal flora by giving the patient antibiotics to treat a different illness, or the client becomes immunodeficient or immunocompromised. For example, clients with AIDS or patients that are receiving chemotherapy, for example. So just to quickly cap on this is principles. When we look at the principles of infection, we want to look at the chain of an infection. And the chain of infection is really just giving us a way to understand how the principles of infection work. And why is the chain of infection so important to us at healthcare professionals? It really helps us to understand two things. One, the way how infections can be transmitted. and two, the ways the infection chain can be broken. So once you understand how it can be transmitted, we know of things that can be implemented to break that chain. And so when we look at transmission, this is where your personal protective equipment comes into play. This is where we say one microbe requires a droplet contact precaution, where you have to wear surgical mask, gloves, and gown, versus its contact, where you just need to wear gown and gloves and not necessarily mask, or if it's airborne, where you are required to wear an N95 mask. So we know that these are the various ways that they can be transmitted, or how the microbe gets transmitted. And the other thing is recognizing the ways in which we can break that chain and prevent microbes from transmitting from one person to the next. And one of those big principles applies to proper hand washing, would be one way that we would from the get-go break that chain. So when we look at the chain of infection, it really is a series of events that has to occur in order for a disease-causing microorganism to actually cause an infection in their host. So looking at the chain of infection, these are all the different factors that will contribute to the infection. So first off, we want to start with the infectious agent. So this would be, your example here will be your bacteria or your virus or your fungi or protozoa. Then that infectious agent will then find a susceptible host. And so your susceptible host could be someone with decreased immunity, someone at the time that was in line of that bacteria or virus trying to enter. And then once the susceptible host has been located, then it would be a portal of entry. Now the portal of entry could be via the mouth. So if it's something like hepatitis A or E, where it's a foodborne pathogen, it could be from consuming food that has been contaminated. It could be via the inhalation, so via nose. So most of our things like influenza, where we inhale that pathogen, and that's because of inhalation. Then we have to figure out a way of transmission. So for example, like our hepatitis A or E is through food, well, contaminated food and water, I should say. And with other things like influenza, could be from sneezing, could be from sneezing in your hand, you're touching a contaminated surface. Then portal of exit is how it leaves that host where it was in. It might then go into reservoirs where you have those people that are carriers, and so they carry that microorganism and then transmitting it. So when providing care for a client in a healthcare setting, these are common terminologies that might come up, different types of infections that clients can obtain when they're within our care. And two of those are nosocomial or iatrogenic. With nosocomial infections, that's where a client is acquiring an infection as a result of their hospitalization. So while they're in the healthcare setting, they are getting an infection that is associated with the delivery of the healthcare service. So if you take an example, a client comes in for a broken hip, for example, but while hospitalized for their broken hip, they end up getting a pneumonia or some sort of infection from being hospitalized in that area. Okay, so why do this stuff happen? So why can a client potentially end up with an infection or nosocomial infection as a result of their stay in the hospital? There's a number of things. So could be overcrowding in the hospital or the healthcare facility. Use of contaminated instruments can cause this to occur. Not controlling the chain of infection. So remember again, simple hand washing. So if we're not washing our hands properly or breaking that infection chain, then we're transmitting it from one client to another. When we're cohorting people, and what we mean by cohorting, we're putting the client in the same room with someone that can potentially be contagious person, and sometimes we don't even do that knowingly, right? So the other person are reservoirs, or they are asymptomatic at the time, and so we're cohorting these patients together, and so you end up with a nosocomial infection. How does an iatrogenic infection differ? The iatrogenic is an infection that occurs as a result of us providing medical or some sort of nursing treatment or procedure to the client. An example, you're going to put in a Foley catheter to drain a client's bladder. That is a technique that is an aseptic technique. Now you, as the nurse, the primary nurse for that client, fails to carry out proper aseptic technique, then that can lead to the client developing a urinary tract infection because of that intervention that you're performing. All right. So one big question, are all nosocomial infections iatrogenic? Yes or no? And why or why not? So all nosocomial infections are not iatrogenic. Because remember, as mentioned earlier, nosocomial infections can also be as a result of overcrowding in the hospital. So it has nothing to do with a medical intervention that you've provided. You cannot necessarily control overcrowding, right? If you have a number of clients coming in and they're all requiring admission and they're all requiring to be cohorted on that unit, that may not be within your control. So the answer to this is no. All nosocomial infections are not iatrogenic. So we're going to look at the stages of an infection. And when we look at the stages, the very first stage is your incubation period. And in the incubation period, we're looking at number 1, number 2, number 3. So in the incubation period, this is where the microbe, the pathogen, enters the host. So the pathogen is able to break the host defenses. So any one of those 3 lines of defense, your first line, second line, or third line of defense, the pathogen was able to break the host defense and enter the host body. Once the pathogen enters, it's then going to colonize at the appropriate site where it wants to mount that infection. So if it's a urinary tract infection, it's going to go to the bladder. If it's going to cause hepatitis, then it's involving the liver. And once they get to the site that they wish to go, they would start to multiply in order to increase their number and start to play house. So that's number 3, where it's reproducing very rapidly. In the incubation period, you want to ask, how does the client feel? So actually the client still feels well. So the client is asymptomatic. Okay, so they're asymptomatic, meaning that the client has no symptoms during the incubation period. Now, the second stage to the infection is the prodromal period. And that's where I'm going to use a different color. I'm going to use red this time. Number 4 is going to match with the prodromal period. And this is where we have the microbe has now multiplied itself in the system to a large enough number where the client will now start to have signs and symptoms. However, the signs and symptoms is very generalized. So more generalized signs and symptoms. So if we have the client in this stage, we may not be able to make an exact diagnosis. So here is where you're starting to say, I'm really not feeling well. I think I'm coming down with something. The client might also have something like a headache. They're starting to report. So as the microbe starts to continue to reproduce and colonize, that's where we're now going to move into the third stage of the disease process, which is our acute. And number 5, and number 6 is going to apply to the acute period. So number 5 and 6 applies to the acute period. So in the acute phase, the client is going to have specific signs and symptoms, where they're able to, if it's a urinary tract infection, they're going to have burning and pain and voiding, increased urgency and frequency in urination. If it's a liver issue, might have right upper quadrant abdominal pain. And then as the microbe continues to grow, it will do so until it is overcome by the host defenses. Okay, so that's where number 6 ties in. It's going to start to be where your body defense is going to try to rid you of that infection. So here's where the curve kind of split. So if your body is able to overcome, the host defenses is able to overcome the infection, we will move to number 7, which is the recovery. Okay, so we'll move into recovery. If we do not move into recovery, and if the host defenses is not able to cure, so the local signs and symptoms of an infection is very similar to that of inflammation that you've covered before. So when you think back to what are the signs of inflammation, if you have an area that has an infection, the local signs and symptoms will be the same: redness or erythema, swelling or edema, pain, loss of function in that area. Okay, also you might have your lymph nodes are swollen or lymphadenopathy, depending again on where the infection is. So if you have a strep throat infection, then you're going to expect to have swollen lymph nodes in the neck, for example, or cervical lymph nodes are going to become swollen. And so symptoms are really going to be related to where the infection is. So you can have more specific symptoms to the area. Those local signs are going to be specific to the area where it is. So for example, if you have a urinary tract infection, you're going to expect to see more burning and sensation or increased frequency in urination, as mentioned earlier. If you have hepatitis, you might have some right upper quadrant abdominal pain or epigastric pain. In addition to these local signs, just as in the case of inflammation, there's also going to be systemic signs of an infection, which we'll talk about on the next slide. So just like mentioned before with the local signs of an infection, systemic signs of infection is very much the same as those of systemic signs of inflammation. So the whole body is affected, where we see things like fever. We're going to see stuff like leukocytosis, which is an increase in white blood cell count. We're going to see increase in ESR, erythrocyte sedimentation rate, increase in CRP, C-reactive protein. These tests are not diagnostic to identify the source of an infection, so they're very non-specific. They only indicate that the client has an infection or an inflammation going on. But for example, to diagnose the client with a urinary tract infection versus inflammation of the pancreas or infection involving the gallbladder, they're not specific in that sense. Systemic signs also increase malaise, fatigue, weakness, anorexia, and a headache. Fever is one of those things that we'll cover later in terms of kind of dissecting fever a bit more. When we look at our diagnostic tests, culture and sensitivity, which you would probably often see referred to as C and S, is something where we take that sample that we're going to test, or we take blood, and we're going to grow it on that agar plate and decide what type of microbe is the patient developing. Other blood tests, we're going to look at the white blood cell, and so we're looking for increase in white blood cell, or also, which is leukocytosis. We might actually see a decrease in white blood cell when it comes to viral infection, leukocytosis more so with bacterial infections, where we're seeing an increase in our white blood cell count, increase in neutrophil count, because as you remember from inflammation, the cellular response to inflammation, neutrophils is the first white blood cell to go to the site. We can also look at doing diagnostic tests such as X-rays, CT scans, ultrasounds. Those are all diagnostics that we could do on the client.